I'm Dr. Jerry Williams with Urgent Care 24/7, here to talk to you about nosebleeds. And if you're watching this video, you've probably done a search and you or a loved one or a family member is maybe having a problem with nosebleeds and you want some information on it. So I'm going to do my best to tell you a little bit about nosebleeds, give you some common sense advice about how to deal with this. First and foremost, you have to put the nosebleed into the particular patient to understand what's the best way to handle it. If it is a patient who has a history of any kind of bleeding disorder or any kind of illness that would affect platelets or bleeding, then nosebleed is an emergency. You need to get to medical care immediately. Now, if it's fortunately those are not as common, because fortunately there aren't a lot of people with bleeding disorders. But first and foremost, let me tell you, you got a history of bleeding disorder, or you have any kind of medical illness such as cancer or leukemia, anything that could affect your platelets, or if you're on medication that is like warfarin or Coumadin or antiplatelet agents that disable your platelets, say for coronary artery disease or any kind of cardiac issue, then totally different ballgame, because obviously you don't have normal clotting. But if you are a normal, healthy person and you don't have that problem, the first thing you want to do with a nosebleed is immediately apply pressure. And you want to apply pressure consistently and firmly for 15 minutes. Now, let me tell you, that's a long time when you're sitting here like this. So make sure you time yourself, because it's very difficult to hold your nose and to keep pressure like that for 15 minutes. Also, if you have that nosebleed and you're holding pressure, sit up, because that decreases the venous pressure in the veins and the vessels of your nose. So sit up, and also lean forward, because that's going to cut down on swallowing blood down the back of your throat if blood is going back through your sinus cavity, back down your posterior pharynx, your nasopharynx, into your posterior pharynx where you actually swallow the blood. So lean forward, sit up, lean forward, apply pressure for 15 minutes. Really important. And time that. Make sure you do it for 15 minutes. Do not blow your nose. If you blow your nose, especially if it stops bleeding, you can push the clots loose or blow the clots loose that are occluding the area that's bleeding, and you can start bleeding again. So very important. In fact, don't blow your nose for 7 days after you've had a nosebleed. 7 days. Also, if you feel like you're going to sneeze, keep your mouth open as you sneeze. It's hard to do, but you can do it. Think about it. And as you feel a sneeze coming on, open your mouth. And when you sneeze, sneeze with your mouth open, and that'll cut down the amount of pressure from the sneeze of the air moving through your nares, through your nostrils, and that'll be less likely to dislodge a clot and cause a renewal of the nosebleed. Now, let me just say this. When it comes to a nosebleed, a simple problem, we've all had them occasionally from time to time. What causes them? Especially dry weather in the winter, when you've got heat or fireplace or wood stove going and you don't have enough moisture in the air, that can certainly dry your sinuses out and your nares out and can cause nosebleed. So it's very common in the winter, especially in cold environments where there's low humidity. But also picking your nose. If you've got any problem that would cause you to pick your nose, very easy to traumatize the inner nares with your fingernail, typically, and that can cause, it's a very vascular area right there, and that can cause some pretty nasty nosebleeds. Trauma, of course, can cause nosebleeds, and sometimes they're just spontaneous. They just happen. So, but nosebleeds can be a very simple problem, but if they continue to bleed prolonged, you can actually bleed to death from a nosebleed. So it's really important, if you don't get control of that nosebleed immediately, within a half hour or so, probably a good idea to go ahead and seek medical care. Because these are simple problems. Your healthcare provider can go in and look. There's certain things they can do with applying medications to the area that's bleeding that cause the blood vessels there to vasoconstrict, thus helping stop the bleeding. And sometimes it's necessary for them to cauterize. We typically use what's called silver nitrate, which is a chemical, and we do a chemical burn to the area that's bleeding, and that'll stop the bleeding by cauterizing the area. Or they can cauterized with heat, though that's less common. It's usually the silver nitrate. But then the other thing that happens sometimes, they have to literally put nasal packing in to stop the bleeding. These are very uncomfortable. They have to be put in by a medical professional, and you have to typically have pain medication when you get those in as well. And that's typically done under the care of a medical provider in urgent or emergency medicine, or with ear, nose, and throat ENT. So again, if you're it's the wintertime and you're having problems with nosebleeds, humidifier or having a kettle of water on the stove, using nasal saline sprays frequently can be very helpful. But then once you've had a nosebleed and it's stopped, applying an antibiotic ointment inside the nares twice a day can be helpful. A petroleum jelly, such as a polysporin, if you're not allergic to any of the medications that are in polysporin. Or if there's no evidence of infection or anything, you can use petroleum jelly just to keep that anterior nares moist. And again, humidification of your home and your environment, nasal saline spray. Now, also abuse of nasal sprays, medical nasal sprays, such as Afrin and those kinds of medications. Those can also lead to sinus dysfunction and nosebleeds. But interestingly, Afrin and those kinds of medications have vasoconstricting properties. They're actually used in acute, can be used in acute nosebleeds. However, if you abuse those medications and use them chronically over time, they can actually cause, as the medicine starts to wear off, a paradoxical vasodilation or swelling of the blood vessels when the medicine goes away, and that can actually lead to a nosebleed. So the nasal sprays you get over the counter, such as Afrin, those are medications that are to be used temporarily, short term, when you're having a sinus problem. Never, never, never to be used long term. And but again, can be useful in the case of an acute nosebleed. So if you've got any medical problems, in summary, that can affect your bleeding time or your ability to clot, you need to seek medical care immediately. If you have a prolonged nosebleed where you're having trouble controlling it, even without a history of bleeding problems or platelet problems, or taking medications that would decrease your ability to clot, then if it goes longer than 30 minutes, you should seek medical care and get that evaluated. So I really hope that these tips are helpful for you. And if you have an opportunity, pass this video on along if you know someone who suffers from nosebleeds or has challenges with those, because hopefully these tips will be helpful. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.